Hello, and thanks everybody for being here today. I am Dr. Peter Brooks, a professor of nursing in San Diego, California, and I'm going to speak to you today about something that we've been doing within healthcare education to increase patient safety by working together with the diversity that is within our own healthcare teams. So let me just get my screen shared here. And here we go. We're going to foster greater communication and collaboration among health profession students. So traditionally in the US, healthcare students have been educated within their own domains or in silos, as many previous authors have written. After graduation and licensure, they're expected to go out into the world having the skills, knowledge, and attitudes necessary to work together in interdisciplinary teams. The problem with this is that students or new practitioners don't really know who does what on a large healthcare team. It's important for the different professions to know what the others do and how they can best work together for the betterment of the patient. If we don't educate students about that while they're in school, they may never really learn about what the other disciplines do because they'll be so caught up in what they themselves have to do once they get on the job. Isolated education has led to a culture of poor communication, which created gaps in patient care, resulting in errors or near errors in healthcare environments. According to Macri and Daniel, medical errors kill more people each year than car crashes, breast cancer, AIDS, plane crashes, or drug overdoses. Medical errors are the third leading cause of death in the United States, surpassed only by heart disease and cancer. Commonly, medical errors or deaths result from communication breakdowns, diagnostic errors, poor judgment, and inadequate skill. Many errors represent greater problems within systems like the absence or underuse of safety nets and protocols, variations in individual providers' practices, and poorly coordinated care, especially during transitions of care. Healthcare professionals need to reduce errors, and three ways they can do that are by increasing cooperation, communication, and coordination within the diverse healthcare team. There are multiple factors that contribute to patient outcomes, but healthcare team members need to have a deeper understanding of what everyone does to efficiently and effectively organize their care and increase patient safety. Smoothly working together requires team members to understand each other's scopes of practice, areas of expertise, and education. When team members learn the language, norms, and scopes of other disciplines, they'll use their resources and knowledge more effectively. Interprofessional communication and collaboration are key factors in reducing medical errors and improving outcomes, and they should be introduced from the very beginning of healthcare education. Interprofessional education, or IPE, helps build relationships between students in health professions programs. This concept brings together students of different disciplines so that they can learn about, from, and with each other. IPE is important in leveling the playing field so that no one discipline should feel superior or inferior to anyone else. We all have very important jobs to do, which is why we're all there in the healthcare setting in the first place. The World Healthcare Organization declared over 10 years ago that IPE must become a part of all health education programs, yet it has still not been widely adopted in the US. This program may provide a roadmap for more schools to accomplish this, making the greatest impact on campuses where there are numerous health professions disciplines. All the members of interdisciplinary healthcare teams, as well as administrators, managers, and patients may benefit from IPE. It ultimately comes down to better patient care, which should be every provider's goal. IPE optimizes patient outcomes by improving communication and teamwork. Increasing IPE means that there will be more new practitioners who are already skilled or at least exposed to this kind of practice. Many articles exist about interprofessional education involving any combination of a variety of healthcare professionals. Dozens of studies have been done in diverse regions of the world at different levels of education and in a variety of environments of care. They all seem to demonstrate that IPE is useful, enlightening, appreciated, and enjoyed by the participating students. They all extol its benefits and importance and advocate for IPE to be more widely accepted and adopted. I will provide evidence of how effective IPE can be, even in the context of two-year programs of education. So what we've done at my college is come up with a full day of interprofessional collaboration and education exercises to get our students used to working together. The students I work with are in cardiovascular technology, occupational therapy assistant, orthopedic technology, registered nursing, and respiratory therapy programs. The ones we chose to participate in IPE Day were in their final semester or year of associate degree programs, and most had had hundreds of classroom and clinical hours, so they would have already formed their professional identities. They had been exposed to different disciplines, but that doesn't mean they would truly know about them. And this day was meant to change that. IPE Day provided different opportunities for students to practice the knowledge, skills, attitudes, and values necessary to demonstrate the 4 Interprofessional Education Collaborative, or IPEC, domains of competency for IPE skills and knowledge development. These include roles and responsibilities, interprofessional communication, teams and teamwork, and values and ethics. The objectives for IPE Day ran parallel to the IPEC guidelines. Number 1, demonstrate interprofessional collaboration, and 2, demonstrate specific discipline knowledge. Components of Objective 1 were exhibiting teamwork and communication, discussing and demonstrating values and ethics, and gaining knowledge of one another's roles and responsibilities. Components of Objective 2 included showcasing one's discipline-specific skills, and then completing the proper documentation related to what they had done. One of the goals for IPE Day was to give healthcare students of one discipline the opportunity to become more comfortable with the other disciplines and more confident when interacting with them as part of a united team. Students were randomly assigned in advance to teams with at least one of each discipline. Their day began with a thorough orientation, followed by team building exercises, a values and ethics discussion, skills demonstration, and a multidisciplinary live patient simulation, not necessarily in that order. The order of the day varied by group because these elements were taking place all at once throughout the day. The objectives were easily met. The IPC was obvious all throughout the entire day. Objective 1 was met by putting all students into mixed interdisciplinary teams, one from each discipline, allowing them to get to know each other as people first and then by their disciplines, including their scopes of practice. The day's orientation began with statistics on medical errors related to poor communication and collaboration, and then discussed the goals of IPE and the logistics for the day. It included information on effective teamwork, such as how to prioritize and perform patient-centered care, communicate one's roles and responsibilities clearly to patients, families, and other professionals, to actively listen to and encourage ideas and opinions from other team members, to engage other health professionals in shared patient-centered problem-solving skills, and manage ethical dilemmas by applying the principles of excellence, caring, ethics, respect, and accountability. The professors stressed that we all exist to provide optimal care for our patients and that no one discipline is any more important than any other. They reminded students to stay organized throughout the day and to keep in mind each team member's expertise. This included delegating work so that no one member became overwhelmed, making decisions through the input of team members, and empowering members to speak up and challenge when appropriate. The orientation was designed to promote and facilitate teamwork, to provide an overview of IPE, and to share logistics of the day. I'll show you a quick video of the day as a whole, and then talk a little bit about each of the individual elements. The students had the opportunity to work together during the team building portion of the day, which consisted of a series of games and activities designed to get the students used to working together and relying on each other. First, they were instructed to line themselves up by shoe size without speaking. After they did that, they were told to arrange themselves by birthday without speaking. Next, each team gathered around a large pad of paper on the ground. There was one marker with 7 pieces of string attached to it. Each student held a string, and they were instructed to work together by pulling the strings to write the word teamwork. This portion of the day was a nice chance to get outside and away from the heavy and sometimes stressful content that was happening inside the building. It was fun, and most students expressed having an enjoyable time while getting closer to their team. Later, they were able to work as a multidisciplinary team in a real-world problem-based simulation, during which they also learned about each other's roles, responsibilities, and skills. The groups of students were given patient information during a briefing session. Actors played the standardized patient and family member, and faculty just observed. Each student in turn performed their assessments and interventions with the patient, responding to the standardized answers the patient actor gave. The actors had a basic script from which they could improvise, and they were standardized in that they all had the same gender-neutral name, medical history, age, and diagnoses. The patients were given response cards to give to the providers after they performed an assessment or skill. For example, the nursing student performed a head-to-toe assessment. The patient then handed the nurse a card that listed the simulated findings that were necessary to keep the story going. Each of the disciplines performed their specific assessments and received standardized findings in this way. The students were able to negotiate time with the patient, sometimes combining their efforts and helping each other out where possible and appropriate. The scenario was designed to achieve the IPE goal of working collaboratively. The case was multiphasic and unfolding in that some of the patient's behaviors and the standardized findings led the team to discover that the patient's condition was declining. This set the teams into varying degrees of chaos, causing them to change or abandon their plans altogether, to work together to figure out what was happening and what they were going to do about it. Per their orientation instructions, the different disciplines were then expected to huddle together to summarize what they found from their assessments and treatments and discuss, problem solve, and then make a plan to call the faculty physician once with all of their findings, at which point they all received new orders. At the halfway point after the physician had been called with the group's findings, the doctor then came in and indeed confirmed that the patient's condition had become dire, necessitating some end-of-life and ethical discussions. The physician ordered the nurse to obtain informed consent for a risky surgery with a low probability of success. The patient declined surgery and chose to discontinue any and all treatment while their family member was pushing the team to do everything they could. It placed the students in an all too common and difficult situation where ultimately they must be the patient's advocate and serve his or her interests rather than those of the family, physician, or anyone else involved. The simulation progressed over about an hour with an extensive debrief period to follow. Objective 2 was met during the simulation as each student demonstrated their skills and knowledge about what their discipline would do with a patient at the bedside. Each team member got to observe the others in action. The students got a taste of real-world acute care situations. These are some of the things that they will most likely be doing during any workday. Ethics education is a fundamental challenge and a major concern in healthcare education. Part of the IPE experience in this study was to collaboratively work through an unfolding end-of-life case study. Students discussed and demonstrated values and ethics while considering end-of-life issues by looking at them through the lens of each of the different disciplines. Then they had the opportunity to apply their knowledge to some real-life ethical dilemmas that, in some cases, challenged their values and what they thought they knew. Values and ethics were also seen during the live patient simulation, part of which involved giving bad news and facing end-of-life questions. The patient and family member had different values and ideas about what should be done. The students learned that it is not just the physicians and nurses who are involved in these kinds of discussions and decisions. The patient and family member are likely to ask any trusted care provider what their opinion is on the situation. Ethical learning causes students to pause and really question themselves, their thoughts, their values and actions, and the consequences of those actions, and how they might affect patient outcomes. Objective 2 was met as students demonstrated their knowledge throughout IPE day, but was best observed during the skills demonstration component because students from one discipline don't really know what the other disciplines do. And many said this was their best part of the day. There were 6 skills demo stations, and as the student groups rotated through the stations, the appropriate student took leadership of the group when it came to his or her station. The students all seemed thoroughly impressed with their teammates' skills and knowledge, and they enjoyed being able to step into the other's shoes and handle their equipment. So how effective was this? Surveys were administered to the students immediately before the IPE event and again right afterwards to gauge their knowledge and understanding of IPE. Specifically, we looked at 3 broad areas: roles and responsibilities, interprofessional teamwork and team-based practice, and patient outcomes. The questions can be seen here. We wanted to assess the extent to which an IPE experience affected students' knowledge and perceptions of the 3 categories R, T, and O. These categories each represent 3 or 4 questions on the survey. Differences in scores between the pre and post surveys were calculated by question, by discipline, as well as by the 3 categories of questions. All these changes and differences between groups were analyzed to see if they were statistically significant. And guess what? They were. The total number of pre-survey responses was 144, and the number of post-surveys completed was 112, for an overall response rate of 78%. So what follows is a lot of boring data information, but the big picture is that 4 out of the 5 disciplines appreciated a statistically significant score, difference in scores between their pre and post surveys, with a p-value of less than 0.001. So the next several slides have things broken down by discipline and a lot of different discussions on reasons for some of the differences. But in the interest of time, I'm just going to skip over that. And if anyone has any questions, I'd be happy to share my complete data with you. So to look at the conclusions to the 3 questions, on IPE Day, students learned about the other disciplines' roles and responsibilities, realizing how their roles intersect and are interdependent. They taught the other disciplines what they were doing and why. In this way, the attainment of knowledge was a shared process of inquiry and creation, as students were not only learners, but they also became co-teachers. By learning from each other and self-reflecting, the students discovered their similarities and differences, comparing and understanding each other's professional perspectives and roles and responsibilities, which helped diminish stereotypes. Team members' interactions and activity affect the care that the patient receives and the patient's safety. So it's helpful if they are familiar with each other's roles, responsibilities, and areas of expertise. Team members are the spokes radiating out from the patient, and they need to trust each other and work together to achieve a cohesive focus, the patient, who is at the center of this circle of caring. Therefore, practicing collaboratively is necessary. Understanding and respecting the roles and responsibilities of other health professionals is important. IPE occurred intentionally as collaborative teams formed, communication built, and knowledge and respect for the roles of the other professionals grew. Talking about shared experiences, scientific principles, research, and seasoned observations reinforces a group's understanding. This was evident on IPE Day as the students shared how they saw a situation from their discipline's point of view and offered scientific rationales to support the skills and interventions they demonstrated. In this way, all the students were able to learn from and with each other. The different approaches that each discipline brought were informing, expanding, and reinforcing of each other's discipline and knowledge, further demonstrating the value of cross-team learning. During the simulation, the students had to work together to figure out what was happening with the patient and what they could do about it from their discipline's perspective. They worked on equal footing and saw benefits from each other's approaches and knowledge. This is important as breaking down hierarchies leads to better communication among all members and can result in learning in all directions. According to the survey results and the student comments, the students had an overwhelmingly positive response to the simulation and what they learned about and from each other while working on their teams. Positive working relationships, effective communication, and teamwork can reduce errors and improve patient safety and outcomes. Students practiced how and when to rely on others, as well as how to be reliable for their teammates. They were encouraged to discuss and prioritize their plan of action as they practiced the give and take of teamwork. They negotiated time with the patient and coordinated their efforts. When they had to call the physician, they did so collaboratively. The T category had a possible score of 20, and the results showed a significant increase in agreement post-training over pre-training with a p-value of less than 0.001. Teamwork and communication were components of Objective 1, and these results indicate that this aspect was met. Conclusions on question 3. IPC and respect are necessary ingredients for increasing the effectiveness of healthcare team members and improving patient outcomes. The O category had a total possible score of 15, and the results indicate a significant increase in agreement post-training over pre-training, P less than 0.001. O items include improving patient-centered care, patient satisfaction, and financial savings through IPC. Some of the benefits of IPC are improved communication and teamwork, leading to fewer preventable errors and less duplication of tasks, which results in reduced healthcare costs and improved patient safety, outcomes, and satisfaction. For example, patients do not appreciate it when someone comes in to take their vital signs if someone else just did it 15 minutes ago. Not repeating a task frees up one professional to do something different in the same time they might have spent doing what someone else just did. Across professions, students reported appreciation of the fact that interprofessional care leads to higher quality patient care and greater patient safety. So there's some recommendations for practice and education. And in summary, IPE is important. Improving teamwork and education and collaboration in education leads to improvements in professional settings, which ultimately leads to improved patient safety and outcomes. The sooner these changes in healthcare education take place, the more professionals there will be in the workplace who are well-versed in IPC. And this may take some of the pressure off of healthcare workers, as they will be aware of what other professionals do, leading to increased teamwork and collaboration, which is a goal of patient care. So IPE teaches real-world care and follow-through. The students in these exercises face things that they may face in any given day of work. IPE ultimately benefits the patients as well as the organization and the healthcare providers who have more confidence and knowledge in their abilities. So IPC optimizes patient outcomes by improving communication and teamwork, and IPE is the pathway to effective IPC. Now, I'm not live, so I don't have time for questions, but my contact info is here. So please get in touch with me if you have other questions or want to see any detailed data. Thank you very much for your time.